4th generation minimally invasive Hallux Valgus surgery with percutaneous guided system, step-by-step skin. The guide paddle should be parallel to second metatarsal shaft prior to proceed to correction. The wire handle is inserted through the guide into the shaft of the first metatarsal and screwed into the guide to maintain the lateral head's displacement. By the use of fluoroscan, the desired degree of correction is related to achieving at least an 50% overlap between the lateral cortex hallux head and the medial aspect of the lateral sesamoid. The head fragment is held in varus against the wire handle, controlling the pronation and dorsoplantar displacement. Then external thread of guide is screwed until to achieve an appropriate clinical and fluoroscopic correction. The head's fragment is held reduced in the previous position. Once the desired reduction is confirmed, the arch of the guide is assembled until it contacts the skin, so that the proximal protector's hole is nearest possible at first tarsometatarsal joint level. Preceded by percutaneous stab incision, the K-wire's protectors are introduced. The distal K-wire is inserted first, and is conducted through the proximal medial metatarsal cortex to the central aspect of the head fragment. This first K-wire does not contact the lateral metatarsal cortex. Nevertheless, it is relevant to avoid distal osteotomy fragment rotation. Next, the proximal K-wire is introduced in a slow fashion, making sure it contacts the lateral cortex. At this point, we should spend time fatiguing the medial cortex to prevent the K-wire from slipping over the bone and intramedullary slippage. This proximal K-wire has to remain parallel rather than converging with respect to the distal K-wire, before it purchases the lateral metatarsal cortex. Once both K-wires are inserted, the guided system is removed. Then, it is mandatory to obtain a strict anteroposterior and lateral X-ray view to ensure that the head of the first metatarsal is centered with respect to the diaphysis. Then, both guide K-wires are measured. It's advisable to withdraw 4 to 6 mm to each K-wire measure, to prevent intra-articular screws placement and proximal medial screw prominence. Next, by 3.2 mm drill bit, both K-wires are over-drilled. The first distal 4.0 mm neutralization cannulated screw is inserted. Slight compression through dorsiflexion maneuver of the head's fragment is advisable at the moment of screw fixation in order to avoid loss of reduction. Next, the same procedure is repeated for the proximal screw insertion, in this case ensuring both medial and lateral cortex purchase. Finally, the proximal medial first metatarsal bone spike is removed using a 3.0 by 13 mm wedge burr. An minimally invasive akin procedure, not shown in this video, usually is performed.